Yes, we have done a Spanish consensus of a treatment of multiple sclerosis, because the previous one that was 10 years ago, and really in 10 years we have now a lot of treatments, and we have changed the way to treat in multiple sclerosis. So that one of the important points is that we can, first, that we should treat the patients from the beginning. We should treat the patients in a very early way. But the second important thing, that we can treat the patients from the beginning with a high-efficacy therapy. So some years ago, we thought always we need to start with a moderate efficacious treatment, let the high efficacious treatment, later very high. But now we are doing what the English people say, flipping the pyramids, so that when we see that the patients, they have bad prognostic factors, we can treat these patients with high efficacious treatment from the beginning. That is a completely different thing than in the past, and this is very complicated, because normally the neurologists, they are very conservative, and they start, at least in Spain, to treat always with a very low efficacious treatment, and later they are escalating. But we emphasize in the consensus that it's very important that for patients with bad prognostic factors, we can start with high efficacious therapy. That is one of the most important things. The other important thing is that we need to know how to detect the progression of the disease. And other important point is that when we see that the patients, they don't respond to one treatment, we need to switch very fast to another one. So we have a lot of treatments, and that is no sin to stay with one treatment when that is not working. So that to stay with one treatment 10 years and that is not working is not useful. So that we say we are writing in this consensus that when you have new lesions or you have a relapse, it's better to change the treatment to a more efficacious treatment.